My name is Kaylee. I'm a third-year medical student currently doing my clinicals in the US, and today we're going to be talking about everything you need to know before you start your surgery clinical rotation. I wanted to do this because I know that the day before I was starting my surgery rotations, I really thought I was going to throw up in the OR, do everything wrong. I had already done my internal medicine rotations, but for some reason, surgery was just so scary to me. I thought I was going to be bored the whole time, and so I just wanted to make sure that I put something out there that might help people. So jumping right into it, one of the most important things that you should know is just how to stay out of the way. A lot of medical students can get super eager and they're just trying to help, or they're trying to really get into it and cut something or really do something. But a lot of the times, if you're in the way, that's way worse. They'll remember you for that rather than doing something good. Like if you're there and you grab something instead of the surgeon, your hand's in the way, your face is in the way because you're trying to see what's going on and the surgeon can't see, that's just way more annoying. And if you're in the way of the surgical tech because they're trying to hand the things to the surgeon or the resident, if you're in the way of the resident, especially they're trying to be actively part of it. So don't take anything away from them because, they're training for a while and sometimes they don't get to do a lot. So if you're trying to take over, then that doesn't really look good. And they're the ones that are, giving you instructions majority of the time. And so that's the most important thing. So number 2 would be knot tying. Like if you're going to be doing anything, it's probably going to be knot tying, and also certain stitches. I didn't really do any simple sutures like the ones that you kind of see in the movies where it's just quick and easy. I did more intradermal or subcuticular. Those are a bit more complicated, and if you mess up, it's okay, but just try to practice that at home if you can. I use one of the kind of fleshy things. It's definitely not anywhere close to the real thing, but it's a good idea just to practice. I thought I practiced enough. I went home and I practiced the stitches and the knot tying all the time, but once you're in it, you can choke, kind of like what I did, where my brain just stopped working whenever they were like, just tie this knot. And I practiced a million knots. But whenever they told me to do it on a real person, I was like, or if there's a lot of times it's not the same as doing it at home. You have a perfect stitch or you have the perfect layout. All you have to do is do it. But in real life, sometimes you're literally doing a stitch in an armpit, or the person is a bit overweight, so you're kind of like this, or so it's a good idea to practice and kind of practice in awkward ways, because a lot of times too you're doing it with other people. Sometimes the resident will be doing it at the same time, so you have to practice doing it not with your elbows out like this, but like this. So a lot of the main things that students do are, like I said, the knot tying, the suturing, specific ones that aren't too complicated. You'll never do suturing fascia, probably. I don't know, maybe at a trauma center or something, but definitely that's a very important part, and that's what gives people hernias. So definitely not going to do that. So make sure you get down the simple one-handed, two-handed knots, and you get down the simple sutures, the 3 ones that I said. Another thing that students are kind of in charge of is sectioning the air with the section. I know that's I thought that we were supposed to suction only the blood. That's also a good example of how knots get in the way too. When you use the suction to suction the smoke, that's what you're sectioning. You're sectioning the smoke from the bovie. So the bovie is the thing that cuts. So a lot of times it causes some smoke to go up because it's burning. So you use the suction to get it out of the way, but if you are getting in the way of the surgeon, they will not be happy. They'll tell you, I can't see, and they'll be very angry. So just try to make sure that you do it, because it's not the biggest deal to get the smoke out of the way in comparison to making sure the surgeon can actually see. So make sure that, it's nice to help, but at the same time, try to be, not too much in there, blocking it and everything. So that's kind of 4 things that the students are in charge of. And then another one would be the aftercare. Sometimes some teams will put the med student more in charge than others. Colorectal, I was changing all of the wounds. I got really good at basically wound management. So if you are good at those things, then that's good. Try to look ahead, like, okay, do I put gauze? Do I put, just open air? Do I put a abdominal wound, like an abdominal pad on top? Like, it's just good to look that up beforehand and even like learn the different tapes. Like, I know that that's something people don't really think about, but if you're good and quick at it, then they'll really appreciate that, because a lot of times they're changing wounds or changing like the post-op bandages like while they're rounding. So it's better to be quick, because otherwise they're going to leave you behind. So, just having that down is a good idea. Just looking it up, making sure that you know the patients beforehand, maybe even having like everything ready before you even walk into the room. That will really impress them. Something else that med students tend to be in charge of whenever they're in the OR is the driving the camera, and that's just nerve wracking. So I mean, if you can practice somehow, I don't exactly know how you would. I'd maybe just like looking it up on YouTube or something. I know that I just kind of went into it, and you just know that you're going to be yelled at, because it's for laparoscopic surgeries. Like when you have the camera and you're, in the body, a lot of times they're kind of just going to yell at you, and that's okay because it makes sense. The surgeon's like, I can't see perfectly, or like they're yelling at you like, find the horizon. So the horizon is the spleen, or and if you're rotating it wrong. So just be ready to get yelled at and try your best to learn it in whatever capacity you can. So those are kind of the 5 things that med students should be pretty good at, like have down to really be helpful inside and outside of the OR, which is the knot tying, the suturing, the driving the camera properly, the suctioning of the smoke and the blood or whatever is coming out, and the pre and post care of patients. So, like the wound management and everything. Because if you think about it, all you're trying to do is make the job of the resident and the attending easier. So, making everything look better in the OR, making sure the patient is taken care of outside of the OR. That's the best way to shine, really. So, in terms of knowledge, the most common thing that I was pimped on was anatomy. Like when you're in the OR, a lot of times they would literally just be like, what's this? And you had to know. And a lot of times it was like, they like for colorectal, they had the intestines literally like flipped upside down and everything was all over the place, but you still kind of had to know. So the way to go about that is just try your best to use your anatomy skills, try to really learn anatomy. I know that I had a hard time with that because I hadn't had anatomy in like 2 years. So just try your best to go back to whatever helped you learn anatomy the most. And, there's a lot of good videos that will show you the anatomy of like what operations you'll be using. So say you have an OR day the next day and you know that you're going to have certain patients. What you should do is look at the schedule for the surgeon the next day, find the operations and find the patients. I think the best way to do that is like find the patient, get all of the meds that they're on. So are they on any anticoagulation? Because in the OR they'll ask, were they on warfarin, were they on this? Because maybe they're bleeding a little bit extra. See if they were taking antibiotics. Just try to get to know the patient and get to know what's going on. So that's what you do like the night before. Besides just knowing the operation, you should also know the patient, because they'll ask you questions sometimes in the OR. So that's one thing that you should have down. And you don't even have to know like way too much. Like, why are you doing the operation? Cool, you're doing a Whipple. What kind of cancer was it? Like, when did they discover it? What were the CT findings? Like, it doesn't have to be a crazy in-depth search. You don't have to find everything that's wrong with them, but it's a good idea to just get the basics, like what meds they were on, why are they here, what did it look like on imaging, because they definitely had imaging and workup beforehand. So that's definitely good to know. And then you move on to the operation. What operation are they getting? Why are they getting it? Like this versus that. And then try to find like the simplest video, because they don't really like pimp you on the actual process, but you will get lost if you don't know what's going on. Because a lot of times those surgeons in it, they're doing what they have to do. They're not really worried about teaching you. So it's a good idea to just look up what's going on, try to see the steps beforehand, ask questions while you're in it, because they'll probably just ask you about anatomy. They're really not going to ask you about the steps. Another great way of seeing like what the surgeon does is looking for a procedure note that they've done before on like another patient. Probably you won't see that on like your first day because you don't know what patients they've had. But if you like are in a clinic or something and you look at the patient's profile, you can go back and find like a procedure note and see how they did it. They'll write like, first we started out by doing XYZ, and they'll go into great detail about what they did in the OR, and they usually have a template, so they put this for every single procedure. So it's a great way to like know kind of exactly what your surgeon does. And the most important thing is to ask your patient after surgery is, have you pooped? That's a big one. Have you pooped? Have you passed gas? Are you eating? Are you able to eat? That's what they like to pimp you on to. Like, what's keeping them? Like, why are they still here? Because otherwise, you can just let people go. And that's what you're worried about as a surgical resident or surgeon is like, how do I get them out of the hospital? Because, that's after surgery, that's what you're focused on. So, are they here because they're in crazy pain? Are they here because you're worried about infection? Are they here because they haven't passed gas yet? Because you can pass gas without having a bowel movement and still be okay. But if you haven't passed gas, that's worrisome, especially in like colorectal or anything abdominal, or if their pain isn't managed on non-IV medications, if they're not eating. So that's what they'll ask you, like, why can't I discharge this patient? And you have to know why. Oh, it's because they haven't passed gas and it's day 2. We're kind of worried about that. It's because they have urinary retention. Whenever we try to remove the catheter, they have some residual urine. And a great app is actually called Touch Surgery. I like to use that before some of the surgeries because it's just kind of fun and, not sponsored at all, but it's just kind of fun to go through and see what's going on in the different surgeries. And, it's not hard to look at and it has a lot of good information if you're just looking for something to look at beforehand. It's a good idea before you start a rotation, like getting to know the bread and butter operation. So if you have like general surgery, just try to watch a couple of videos on appendectomies, cholecystectomies, just anything that happens regularly to prepare yourself for that surgery rotation before you start it. And make sure to stay out of the way. That's a big one. Staying out of the way of the scrub nurse, everyone in the OR, because otherwise you're going to be remembered as like that, that med student that just wasn't helpful at all. And so after how to stay out of the way is kind of scrubbing in and scrubbing out. So I know I was scared of scrubbing in and scrubbing out because I was like, I'm going to figure out a way to be constantly unsterile. I'm going to make the operation be slower because I'm going to, be messing things up. But as long as you, are conscious of your hands and everything, you don't just forget that you have hands, I guess, you'll be fine. Just don't touch your face. Have your arms like this whenever you're not doing something. Touch the blue whenever, and just try your best to not be unsterile because that will slow things down. But it really isn't as hard as one might think. So basically, to sum up, what you should really be worried about is how to help the patient, how to help the attending, how to help yourself in ways of just like, being good at what a med student is in charge of in terms of like the wound care, everything in the OR. You should just prepare yourself with knowledge of the patient and of the procedure, basic understandings. You don't have to go crazy. You're still studying for your shelf exams, your board exams, and they understand that. So just get the basics of things. Don't stress out too much about it. They care more of like, the anatomy. They're more impressed if like, what was on the imaging and their medications. They're not worried about knowing like what they ate 5 days ago, or, like they're not worried about their past medical history going back to, or are they vaccinated or something, like you don't have to do anything crazy in depth. So yeah, finally, try not to be too scared. Try to put yourself out there. Try to really engage because it's really interesting. This is a time that you see things, you're doing something, you're seeing it right then and there. It's the time that, you can see medicine in action. You see it with other rotations too, but I think this is the stuff that really sticks in your brain. So just try to be engaged. People appreciate that. You melt less into the background if you ask questions and you actually care. Because otherwise, if you're just a med student that's scared, then they're never going to remember you. And it's not all about being remembered, but you know, if you're trying to get somewhere, you're trying to get that letter of rec or whatever, then you want to be somewhat memorable, right? I'll be making way more of these, so make sure to like, comment, subscribe. I want to hear what you think about this little series that I'm doing, and you know, be ready for the next one.